As students head back to in-person learning, doctors say the pandemic is delaying school immunizations, and it's important to get the doses to prevent school outbreaks. State health leaders want you to be aware of a new Georgia law that impacts rising 11th graders. Atlanta Bureau Chief Archith Seshadri breaks it down from our Georgia Capitol newsroom.
A new Georgia law requires all students who are 16 years and older to get the meningitis vaccine.
MCV4 booster shot, that is a meningitis shot. That age, they're close together, they may be going off to college soon, and that's where we can sometimes see meningitis outbreaks.
Especially with kids going back to school, there's a lot of exposure.
Meningitis is a viral infection that inflames the brain and spinal cord and can be deadly.
Immunization rates for required usual back-to-school vaccines are really low, and that's concerning.
The CDC says the pandemic has delayed routine childhood immunizations because many students weren't in classrooms.
I'm most concerned about the more serious illnesses like the measles, mumps, rubella. All of those immunizations will prevent diseases that are easily spread, especially measles, super contagious. And if we have a low vaccination rates in those illnesses, you could spread those at schools.
It's very important now that we get these vaccinations to prevent, things like the whooping cough. We are able to give Tdap and to prevent things like chickenpox.
As kids get back to in-person learning, doctors say it's important to prevent viruses from spreading, and the best way to do that is to get the recommended immunization shots.
We depend upon what we call herd immunity. We depend upon our parents and patients to receive the vaccinations so that the vaccine preventable illnesses don't result in an actual outbreak.
Reporting in Atlanta, Archith Seshadri, Atlanta Bureau Chief.
With the contagious Delta variant, state health leaders also want to urge parents to get their kids who are 12 years and older to get the COVID-19 vaccine, as only 30% of Georgia children have received the doses.